This is the mandible bone. It's the strongest bone in the face because it's composed only of compact bone, not spongy bone. This is the symphysis mentae. This is the condylar process, which has got a head and a neck. This is the coronoid process. This is mandibular notch. This is body, and this is ramus. This is angle of mandible. This is mental foramen, and here we've got the mandibular foramen. This is the mandibular foramen for passage of the inferior alveolar nerve. The inferior alveolar nerve is a branch of the mandibular nerve, so it will pass through this canal, and this canal continues until the incisor teeth, but in the midway it will give another canal to the mental foramen. So the inferior alveolar nerve will come out from the mental foramen to become the mental nerve, and the inferior alveolar nerve gives off branches to supply the lower teeth. Anterior border of the mandibular foramen is called lingula. This is lingula for attachment of the sphenomandibular ligament. This is a very important landmark in the mandible, which is called the mylohyoid line. This provides attachment, of course, to the mylohyoid muscle. The mylohyoid muscle forms floor of the submental triangle and floor of the mouth. It begins from the mental spine and continues to the region below and behind the third molar tooth. And of course, as we said, this is the mental spine. The mental spine provides attachment for two muscles, the superior one being the genioglossus and the inferior one being the geniohyoid. The mental spine is also called the genial tubercle. The mylohyoid line separates the sublingual fossa from the submandibular fossa. The sublingual fossa is for the sublingual salivary glands, and the submandibular fossa for the superficial part of the submandibular salivary glands. This is the mylohyoid groove. This was the mylohyoid line. The mylohyoid groove provides a passage for the mylohyoid nerve, supplying the mylohyoid muscle. The mylohyoid nerve is a branch of the inferior alveolar nerve, which was itself a branch of the mandibular nerve. On the left side, again, this is the mylohyoid line, mylohyoid groove. We've got four muscles of mastication that attach to the mandible. This is the masseter muscle attaching to the ramus of the mandible. This is temporalis attaching to the coronoid process on the external and internal surfaces. And this is a medial pterygoid muscle that attaches to the angle of mandible, and a lateral pterygoid muscle that attaches to the condylar process of the mandible. We've got five muscles of facial expression that are attached to the mandible. This is the buccinata muscle on the oblique line of the mandible. This is the mentalis muscle. Lateral to that, we've got the depressor labii inferioris, and lateral to that, we've got the depressor anguli oris, and this is the platysma muscle, which is also one of the muscles of facial expression. This is the digastric fossa on the mandible for attachment of the anterior belly of the digastric muscle. The posterior belly attaches to the digastric notch or the digastric groove on the mastoid part of the temporal bone. The digastric muscles separate the submental triangle from the submandibular triangles. This model shows the hyoid bone with the larynx. The hyoid bone consists of body, lesser horns, and greater horns. Body of the hyoid stands opposite the third cervical vertebra, C3. The hyoid bone communicates superiorly with flora of the mouth and the tongue, posteriorly with the pharynx and epiglottis, inferiorly with the larynx. This is all the larynx.